Good morning, distinguished participants. We are indeed very fortunate this morning to have Dr. Swaminathan, who have given a very good address to us and reminded us the importance of biohappiness and to level it up with economic happiness. And in the center of that, of course, is conservation of biodiversity and nature and One Health. So today, we have the panel with us today, very good opinion leaders who are able to give us very good insights into one conduit of One Health concern, which is from food that we eat, the agriculture that we are involved in, to the health of every one of us here. So starting this morning's conversation, we have Dr. Marina Romanello, who is Executive Director of Lancet Countdown. And Marina, I understand that your research has so far been very much scientifically focused, robust, and data-driven on looking at climate and health. So essentially, what are the domains and interfaces in One Health of Asia that you think we should be putting more attention into and to ensure that we do have One Health very well balanced and harmonized? Yeah.
Thank you so much, Lee, for having me here, and thank you all for attending this session. As Dr. Kay just said, I lead the Lancet Countdown on Health and Climate Change, which, for those of you that might have not heard about it, is a very big international collaboration that is led by University College London in the UK, but it's global. We bring together over 300 researchers from all around the world. And what we do is annually, taking the theme of the drums, produce the drum beat of the state of climate change and health. We produce these scientific reports published in the Lancet annually, globally and regionally, where we have over 60 indicators of the state of climate change and health globally. The latest report that we published was published last October, just ahead of the COP climate negotiations. And it showed that across the indicators in which we're monitoring the threats and the impacts of climate change, 65 of them reached unprecedented levels of threat globally. When we look at Southeast Asia and South Asia, what we see the most prominent threats to be are, perhaps unsurprisingly, the threats of heat exposure. In Singapore, for example, exposure to heat waves tripled just since before the Paris Agreement entered into force, so in just a few years. And most of those days of exposure to what could be lethal levels of heat are now driven by climate change. Over 98% are driven by climate change. We're also seeing the spread of infectious diseases going through this kind of One Health narrative. And again, Southeast Asia is the region where we see the fastest spread of environmental suitability, or the fastest increase in environmental suitability for dengue, for chikungunya, for Zika, for deadly vector-borne diseases. And we're also seeing climate change affecting food security. Obviously, that's a huge threat, not only to health, but to societies, to economies. And perhaps what is most important to think about is that it's not just the impacts of climate change on health, but also the drivers of climate change and environmental degradation. We're seeing loss of tree cover, increasing the risk of zoonotic diseases and biodiversity loss. We're seeing deadly levels of air pollution, leading to an enormous burden of disease and mortality from air pollution exposure. And we're seeing, for example, unhealthy diets with very intensive, unhealthy agricultural methods that are also linked to over 10 million deaths every year that could be avoided through more sustainable, environmentally friendly health systems. So we have a huge opportunity to save all of those lives by tackling this compounding crisis at once. But unfortunately, one of the other main findings of our latest report is that across the indicators in which we're monitoring what we're doing about this potentially existential crisis that we're facing, 60% of the indicators are moving in the wrong direction. We're not only not doing progress, we're actually worsening the situation day by day. And of those 30%, we're doing progress are now reversing. We're all aware of the geopolitical crisis, of what that is doing with commitments to tackle climate change. And one of the things that we, as a data-driven collaboration, are particularly concerned about is the loss of data sets. We're seeing data sets being lost by the minute. And let me be clear, We don't need more data to know what to do about climate change and the environmental crisis. We have enough information to act robustly, but the problem is losing satellite data. If anyone knows what MDAT is, it's a collaboration that monitors extreme events and their impact. The funding for those data sets is being lost, mainly because of the US retracting them. And that means that we could very soon be flying in the dark as we try to tackle this environmental crisis. So for philanthropists here, there's a huge investment that is needed in terms of supporting evidence to inform action. The research community is there. There's many institutions that are losing funding, which is potentially a critical situation as we start seeing these events becoming more and more severe and more unpredictable.
Fantastic. I think the domains that we talk about in One Health is so complicated that some of the data are not actually obvious to us, and we do not have sight of it. So I have read about one Lancet publication that rising temperatures not only cause the heat stress in people, but also compress the domains of habitats coming closer together so that the genetic and traits of the viruses and the infections and so on could actually cross into each other's domain, like, the selling of wildlife and so on. So maybe I want to ask Hari, also fetch an opinion from Hari. You come from the philanthropic circle. What can the philanthropy side work? How can it actually complement the efforts that the public sectors have in terms of looking at One Health?
Thanks a lot, Dr. Fouquet. And my thanks to Temasek Trust and Philanthropy Asia Alliance for convening us again at a very important time for these conversations, just given what's transpiring in the world. I want to start with a sidetrack. 1 year ago at the Philanthropy Asia Summit, we committed to establishing a presence in Singapore and setting up an office. I'm very glad to say we now have that office open and staff on the ground, and this is a sign of our commitment to broadening and deepening our partnership with Singapore and the Singapore ecosystem in pursuit of shared goals around equitable development and poverty reduction, both in the region and beyond across the global south. So thank you for this deep partnership. Back to your question, Professor Fouquet. I think the role of philanthropy is an interesting one. In many ways, the challenges we are talking about are old, long-standing ones. It's really poverty and health. Those remain the fundamental challenges. That hasn't changed. I think what's changed in the last couple of decades is the speed and complexity with which the interfaces between these issues actually are evolving. And that shows up the most on the animal health environment interface that Dr. Soumya spoke about. For a variety of factors, climate disruption, rapid mobility, and the changes to food systems across the world. The data on this are pretty revealing, right? Over the last 5 decades or so, out of the 400 infectious disease pandemics we've seen, 70% are zoonotic in origin. So that intersection of the animal health environment interface is one where we need to pay a lot more attention and look for ways that we can engage. And recent examples like SARS, MERS, COVID-19 are all examples of what's happening at that interface. Now, the challenges, therefore, are not what's happening there. We know those threats exist. It's really, are we building the systems to track the threats before they really become real? And that's a role where philanthropy can play a role. Now, the business case for investing in those gaps is something that COVID revealed for the entire world. Over a couple of years, almost 14 million people lost their lives. There are now estimates that the impact to the global GDP in terms of losses will be over 14 trillion. And yet the cost of response to keep the world safe is really about $3 to $5 per year. So the challenge is not one of whether we have the money. The challenge is really, are we prioritizing this issue enough? And I think the role for philanthropy is to make that case undeniable and to really help mitigate some of the risks that prevent governments and private sector from acting. Some of the work that we are doing, for example, in genomic surveillance, offer examples of what philanthropy can do. Open data platforms like NextTrain, partnerships like the one we have with you on the APGI, Asia Pathogen Genomics Initiative, and something similar in Africa. The global standards through PHA for GE, that's a complicated acronym which stands for the Public Health Alliance for Genomic Epidemiology. These are all efforts that provide the tools and benchmarks that the world needs. But the availability of tools is not enough. One of the assessments that your team conducted across 14 countries in Asia reveals that all 14 countries now have the capabilities to do genomic surveillance. What is lacking is really the integration with national surveillance systems and the guidelines to use these tools. Less than half of the 14 countries actually have such measures in place. So having the tools does not mean having the systems that you need to use them. And that's where, again, philanthropy can play a role by taking risks and funding the kinds of innovations that governments and private sector can take on. But I want to be clear that the role of philanthropy is limited and it can only be catalytic. What is required is really for countries and governments to prioritize this issue and carry things forward. And one important question for all of us in this room is to think of these initiatives in terms of what will we leave behind beyond our funding. Success in such efforts does not come from what we build. It's really what continues beyond us. And that's why I feel platforms like the Philanthropy Asia Alliance are important, because they are encouraging us to think collectively, collaboratively, and prioritize sustainability. Thank you.
Thank you, Hari. Pathogen genomics is indeed a game changer as we live through the pandemics from 2003 SARS to the COVID-19. It has actually looked at the way pathogen genomics has actually revolutionized the way we predict how infection can spread, especially from animals to humans, as well as looking at rapid development of countermeasures like vaccines and so on. So I now want to move on to Professor Ramanan, who is from the One Health Trust, and his work centers a lot on animal health. So Prof. Ram, can you give us an idea of how the situation of animal health is, and has it been trivialized in terms of looking at One Health?
Thank you, Dr. Lee. Of course, great for Singapore to lead this. At this time, I think with the action moving to Asia, this is the right time and the right place to have this conversation. How many of you have a cow as your main asset? Anyone? Any livestock is your main asset? Nobody. Now this room was filled with dogs, yes, but yeah, that's a good point. But as your main asset. But actually, if you look at probably a third of the world's population, a cow or livestock is their main asset. And it is the source of wealth for many people around the world. And if you look at the previous century, one of the main things that has happened is a huge scale up in animal protein consumption. If I can have the slide up, if that's possible. If you can look at the global biomass of the planet, which is all the mammalian biomass on the planet, you see what it was in, about 150 years ago compared to where it is now. Today, 30% of the world mammalian biomass is us, humans. 60% of the world's animal biomass is the animals that we mostly consume. Everything else, your dogs, cats, everything else, blue whales, everything is in the remaining 10%, which means we've really taken over the planet, which means that all of the disease risk now comes from the diseases coming via these animals through to us. If you can have the next slide, please. You can see that, and this is the point that Hari also made, 70% of our disease risk, new zoonotic disease risk, comes from animals, comes via domestic animals and livestock, which is why Asia bears the highest brunt of risk when it comes to zoonotic disease. That's number one, 70%. Keep that number, 70% in mind. Second, 70% of the antibiotics used in the world are not used to treat infections. They are used in animals, mostly for growth promotion. So all those animals are getting fatter because of the antibiotics we give them. Third, if you take greenhouse gas emissions, 25% of greenhouse gas emissions, the largest single chunk, comes from agriculture. Of that, 15%, which means 15 of the 25, comes from livestock, which is the methane, which is a very potent greenhouse gas. So you're talking about a sector, Dr. Lee, which is really contributing to multiple areas of both threat, but also opportunity. It's an opportunity to deal with climate change. It's an opportunity to deal with pandemics. It's an opportunity to deal with antibiotic resistance. And it's an opportunity to deal with poverty reduction. And if we can prioritize animal health, which we have not really done so far in a public health sense. So today, and we'll talk about this a little bit more, when we think of things that farmers ought to do like vaccines, we say, oh, you, the farmer, must do it. But we're not really rewarding them for all the benefits that that healthy animal is providing to the rest of us in these other benefits. And let me make one last point here, which is a healthy animal has a very low carbon footprint. The average carbon footprint per liter of milk of a cow in, say, India or Ethiopia is about 10 times that of a cow in the Netherlands. And you may say, why? The footprint is much greater because the cow is more likely to die, it's less healthy, it doesn't get vaccinated, and therefore, for every liter of milk, you're releasing a lot more methane in the global south compared to if you were doing this in a highly optimized system. So we have a great opportunity here to address One Health, but beyond One Health, planetary well-being through animal health. Thank you.
Thank you so much, Prof. Ram. I would like to move on to Dr. Klaus Runge. Klaus, can you come from the private sector, and yours is a big venture in terms of agriculture and health. So how would you think that, taking into consideration of what Prof. Ram has said, the importance of animal health, in terms of productivity, how would a big private company like yours be able to set the standards as well as your practices in terms of agriculture to ensure that there's minimum risk from farm to fever?
Yeah, thank you for the question. Let me start with a few numbers first. So within my lifespan, I was born 1975. The number of people living on this planet has actually doubled from 4 to 8 billion. Out of these 8 billion, 4 billion people don't have regular access to basic healthcare. And roughly 1 billion are chronically hungry, and 2 billion individuals are often or permanently exposed to heat, to health-threatening heat. So these are numbers that you need to let sink in when you work for a company whose mission is health for all, hunger for none. So, and you see that we've consistently worked since 2019 when we set up our sustainability agenda to live up to this commitment. Now, what does it mean in practice, to your question, in the businesses that we are active in? So we have defined 3 impact areas, the first one being climate action, the second health equity, and the third one food security. And that's where we center our partnerships around and our solutions that we bring as an innovative company. So when you look into the health agenda, for example, look into vector-borne disease, we're amongst the leaders in research and combating neglected tropical diseases, which, as we also heard earlier today, also spread not just with climate change, but also with migration. So we have to really keep up with standards and monitoring systems and also regulatory approvals for these products in areas that previously had not been exposed to these entities. So that's one example. Another example at the intersection of climate and health and our customer base is that a lot of farm workers who are exposed to extreme heat and high humidity develop chronic kidney disease early on in their life. So there's a term called Mesoamerican nephropathy, which is not just limited to Mid-America, Central America, but it's been described there first. And we do a lot of research on what heat and humidity do to the human body. And that's also something we do in partnerships with academia, but also with many of the institutions here at the table. When you think about the agricultural side of things, of course, we want to promote regenerative agriculture. It also means that we promote responsible use of pesticides and herbicides, and by the way, also responsible use of antibiotics in livestock farming. That's definitely an issue. We have contributed to an industry fund which has collected $1 billion to find new antibiotics. That is really overdue because we have a market that's not really working. So we need different mechanisms to foster innovation and to fuel the pipeline. And in agriculture, we also try to bring innovative solutions and solutions for adaptation to our customers. And many of them are in LMICs, many of them are in Southeast Asia. It's roughly 550 million smallholders living in this world. And we try to help them with innovative products. So new seeds for crop that are more heat resistant, use less water in the area of rice cultivation, for example, short stature corn. These are some of the innovations we can offer, but they need more. They need digital solutions that help them with weather forecasting, optimization of how to use their fertilizers on their fields and in relation to the status that the crop is in. So there's a lot of innovation we can bring to the table in that area too. So I think we're well vetted to offer innovations, but we need partners to scale because some of the areas we invest in are not of high return. So, and it needs time to transit them into more attractive businesses, and that's what we need finally to reach even more people living on this planet. Thank you.
Thank you, Klaus. I want to go back to Prof. Ram again. And Klaus mentioned about regenerative agriculture and new innovations. And Prof. Ram has actually gone wrong with the husbandry. Why are people using so much antibiotics right now? And, you know, protective antibiotic regimes that people use to cover animals from diseases. So what is your opinion, and how should we pivot away from that?
Well, in one word, it's really animal vaccines. We've been using antibiotics in animals for the last 70 years because this was the fastest way to get them to grow, and it was a source of growth promotion. But it's created huge amounts of resistance, and as Dr. Soumya Swaminathan said in her keynote, AMR is one of the biggest threats facing every country, whether rich or poor. It's a big issue here in Singapore, in all the hospitals here. It's an issue in China, in India, and a lot of it comes from the animals itself. We have to remove antibiotics from animals, but we can't tell farmers don't do something. That's not a reasonable thing. We can tell them what to do, and I think animal vaccines have significant benefits beyond animal health and productivity. I think the 4 points there are they can do the poverty reduction. It is shown as one of the best ways to reduce antibiotic use in animals. In fact, in the United States, we have antibiotic-free meat. All those farms use animal vaccines significantly. Now, those benefits are not there across all the countries because companies are not yet registering these vaccines in countries. And I'm sure Dr. Rangi would tell you, well, we're not doing it because countries are not necessarily purchasing the vaccines. Now, we had the same issue with childhood vaccines as well 20 years ago, and we set up Gavi. We need to set up something like Gavi for animal vaccines because the cost of not doing something is for mariners, indicators to keep sliding backwards. We need some positive effort, and I think animal vaccines are really the way to go.
Fantastic. So, Hari, can you quickly comment on, some of these investments that you want to make vis-a-vis, what Prof. Ram and Klaus has mentioned that will bring a lot of benefits to One Health?
Yeah, thanks, Professor Fouquet. there's a number of dimensions one could go down. But I think if I were to pick one area to focus on, it would really be an integrated One Health surveillance system that leverages AI and real-time data. Because we have a lot of the tools that we need to generate the greater visibility that is required, for us to know what's happening at that human-animal environment interface, which is where a lot of the risks lie. Even the issues Ramanan is talking about, or issues around food security and safety, and pandemic preparedness, they're all kind of connected. The underlying challenge in all of them is, do we know what's going on at that interface of, human-animal environment? And I think an early warning system that allows us to move away from a reactive to a more preventive, predictive approach is what is needed. And I think AI-enabled One Health surveillance system can do really that. It can help us with AMR, because AMR spreads through water, through human contact, through animals, and it happens in an invisible manner. So you do need ways to track what's going on. Wastewater surveillance is a fantastic tool, right? Wastewater surveillance doesn't require humans to show up for testing. You can really pick samples from the environment, and because most viral pathogens that could lead to pandemics are actually shed through human stool and urine, you can actually pick them up from the environment, and if you have the right tests, get ahead of the pandemic. I think the next phase of what we need to do in the world, but particularly in Southeast Asia, is to create these systems that allow us to get ahead of the pandemic before it gets a problem, before it becomes a crisis. And I think AI enables us to do that. I mean, you're already seeing AI algorithms being able to predict flu pandemics 1 or 2 weeks in advance of when they manifest. And 1 or 2 weeks in the context of a pandemic is massive. It's the difference between a widespread pandemic and one that gets contained. So I really feel that's the opportunity for us. But I do want to say that the technology is no longer the challenge. The science is no longer the challenge. I think the challenge is getting the right kind of partnership models and the right kind of political will to prioritize this issue, so we're not scrambling when the next pandemic hits us. We know it's going to happen. Only question is, can we get ahead of it?
Thank you so much, Hari. I would like to now go to Marina to help us to look at this investments that priorities that we want to put into One Health. Prof. Ram mentions about vaccines, and Hari mentioned about surveillance enabled by AI, and Klaus mentioned about regenerative agriculture. What about you, from the Lancet point of view, looking at all these data that are coming in, what is the best thing that you think, the most important thing that Asia should put focus on?
Thank you so much. So I think the common narratives that you have this compounding crisis, this ecosystem crisis that we are driving, and that the solutions are out there. We have technological solutions that are at hand, from vaccines to renewable energy, which Asia is leading the way by far. And you have also the opportunity to change the way that we do health, and that we think about prosperity, and that we think about well-being. And Somnia put this so well, in that we need to move away from thinking about GDP to thinking about how we're going to make people's lives better, how we're going to make people healthier, more prosperous, how we're going to increase levels of well-being. That requires healthy jobs. But that's not the end goal. The end goal is to make people's lives better. So with our data, we often say we don't want to be monitoring our own demise. We want the data to be actionable. And we are sounding the alarm. We've been sounding the alarm. We have the solutions at hand. And we always used to say tackling climate change could be the biggest global health opportunity of the century, because it could help us improve the way that we produce our food, reduce the health harms of unhealthy diets, reduce the risk of AMR, reduce the risk of air pollution, one of the biggest determinants of ill health globally. But I think at this point, with the millions of unnecessary and avoidable deaths that we're seeing each year due to our inaction, it's no longer an opportunity, It's a public health imperative, and we don't have any other way to a healthy, thriving future than to think about this compounding crisis as connected, system-wide crisis that AI can help us solve, that technology can help us solve, but that our conception of health and well-being should help us solve so that we can actually have a prosperous future. Otherwise, we'll be in deep, deep trouble.
Thank you so much. We have come to the end of this panel, and let's put our hands together to thank the good opinions that our leaders have given to us, and take this into consideration as we look at One Health. Stop farm to fever right now.